Good morning, class and professors. My name is Vanessa Gomez, and I'm here to speak with you all today about my health policy recommendation. Today I will speak to you about universal contraceptive coverage. Let's get into this. Contraception is the intentional prevention of pregnancy by any method of various drugs, techniques, or devices. So here are the different types of contraceptive methods. So some of them you might already be familiar with, such as the birth control pill or condoms, but there are other methods such as the female tubal ligation or the male vasectomy. There is the IUD, the intrauterine device, which is something that is implanted by a physician into the uterus. There are also the natural rhythm methods, where some can decide to abstain from sex or just use birth control on the days that they're most fertile to avoid getting pregnant. There's also the birth control shot or even vaginal ring. So as you can see, there's a variety of different birth control methods that are out there. So back in 1960, the birth control pill and the intrauterine device were available in the United States. That was also known as the era of modern contraception. Birth control has been a topic of controversy since its beginning in our country. Conservative individuals believe that contraception is morally wrong, unnatural, a form of abortion, or even anti-life. However, many feel that contraception is beneficial in a number of ways. So contraception allows sex to be more pleasurable and improves intimacy rather than just for reproductive purposes. Contraception has empowered women in the workforce, in achieving higher education, promoting autonomy, and even increasing life expectancy in women. So in 1965, the Supreme Court ruled that states cannot prohibit married couples from using contraceptive methods. This was in a case, Griswold versus Connecticut. But it has meant that unmarried women were not able to access birth control at that time. But now, in 2018, there are approximately 72 million women of reproductive age in the United States. So that's women between the ages of 15 to 49. And approximately 47 million of these women use a method of contraception. In 2020, the U.S. contraceptive market is valued at approximately $7 billion. So what's going on today? So the Affordable Care Act, also known as Obamacare, required employers to cover birth control in their employer-based health insurance plan. However, this year, in 2020, the Trump administration challenged the Affordable Care Act in the Supreme Court to expand religious and moral exceptions to regulations, which means that employers can opt out of including birth control coverage in their health insurance plans for their employees. So there's companies such as Hobby Lobby that they were in the news a lot this year and last year because they don't want to include birth control for religious purposes in their health insurance plan of their employees. So my problem statement today is that in July of 2020, the Supreme Court ruled that employers can object to contraceptive coverage due to religious or moral reasons for employees and students. The government now estimates that 70 to 120,000 women will immediately lose access to contraceptives as a result of the ruling. It is likely that the newly conservative majority Supreme Court can soon threaten to revoke all or most contraceptive forms in the near future, and this harms American families, women, non-binary individuals, as well as trans men. So the stakeholders in this problem that I'm discussing with you today, there's many, but I wanted to focus on the top 3, which are patients, pharmaceutical and medical device companies, and the general public. So the patients are the first stakeholders that I wanted to discuss with you all. So losing access to birth control is an attack on the autonomy of Americans. It's dangerous to the health, physically and mentally, of millions of individuals. Birth control is proven to benefit women in a number of ways, in addition to preventing unwanted pregnancies. Birth control can help lighten periods, reduce menstrual cramps, prevent or lessen acne, anemia, and even some cancers. Contraception has allowed women to join and thrive in the workforce since the 1960s. 1/3 of the wage gains women have made since the 60s as a result of access to contraceptive. The most influential factor for women to stay in college is access to birth control before the age of 21. College enrollment of women has increased with the access of contraceptive, thus allowing women to get further in their higher educational achievements. Access to contraception allows women to save money and become the breadwinners of their household due to preventing or prolonging having children. Birth control is essential also to transgender men because they can still get pregnant even undergoing hormone therapy and taking testosterone if they still have a uterus. With trans rights constantly under attack, having access to forms of contraceptives is necessary to protect their rights. So pharmaceutical and medical device companies are also affected by this change. So more than 90 name brand and genetic oral contraceptive products were on the market by the year 2007. It is estimated that the contraceptive pill market will reach $20 billion worldwide by the year 2026. So with employers having the option to opt out of covering contraceptives in their insurance plans, pharmaceutical and medical device companies can lose revenue due to this change. So a majority of people who use contraceptives depend on their insurance plans to pay for it. So lastly, the general public is very much affected by this, and this includes men as well. So the World Health Organization has recognized the birth control pill as an essential medicine because it meets the healthcare needs of the population, is a public health relevance, has evidence of efficacy and safety, and is cost comparative effectiveness. So evidence shows that effective contraceptive use reduces medical costs associated with unintended pregnancy and births. It also prevents the health, social, and economic costs of adverse outcomes for mothers and infants of teenagers or unmarried mothers. So the birth rates of Hispanic teens and non-Hispanic Black teens were more than 2 times higher than the rate of non-Hispanic white teens in 2017. Children of teenage mothers are more likely to have more health problems, be incarcerated, give birth as a teenager, and or have a lower school achievement. And although teen birth rate has dropped over the years and has resulted in $4 billion in public savings alone, without access to adequate birth control, the statistics and costs can rise again. So I have 3 options to suggest in helping fix this issue. So the Supreme Court can just simply overturn its latest ruling and mandate employers to include birth control in their employer-based health insurance plans despite religious reasons. Next, the Supreme Court can just mandate all insurance companies to cover all forms of contraceptives. So that includes surgeries as well, like the female tubal ligation or vasectomies. Not all insurance companies cover it fully, or they do it just partly. But my second suggestion would be for them to just cover it, all forms of birth control. Or my last suggestion would be the Supreme Court can mandate companies to cover all forms of contraceptives and make short-acting hormonal methods available without prescription and over the counter. So my recommendation today is that the Supreme Court should mandate all health insurance companies to cover all forms of contraceptive and make short-acting hormonal methods available without physician prescription over the counter. So my suggestion would be that insurance companies will cover long-acting reversible contraceptives, short-acting hormonal contraceptives, and male and female sterilization procedures. So implants and medical procedures are required to be performed by a board-certified physician the way it's always been. However, I would want the insurance companies to cover, like I said, the sterilization procedures, as well as all the other forms of birth control methods that are out in the market. And then also short-acting hormonal methods such as the pill, the patch, and vaginal rings will be made available over the counter and without physician prescription. And this will be allowed for women or whoever to have access to these birth control methods that are 18 and older. and these methods will be clearly labeled and advertised, informing consumers of its proper use, directions, and side effects. It will be available for those 18 and older. Birth control methods like the pill patch and vaginal rings have been proven to be effective and can have side effects, just like all of the other approved over-the-counter drugs that are available today. So condoms, spermicide, contraceptive sponges, and emergency contraception will still be sold over the counter the way that it's always been as well. So to conclude, individuals with health insurance will have access to affordable contraceptive of their choice. Making birth control methods more available will provide access to all individuals with and without health insurance. Pharmaceutical and medical device companies will continue to benefit and make profits with this recommendation. Individuals will finally have complete autonomy of their health. Universal contraceptive coverage is a healthcare right for individuals and should not be affected by political and/or religious views. Effective and adequate access to contraceptives has been proven to benefit the United States and Americans both socially and economically. Thank you for listening. Have a great day.